I'm Dr. Christopher C, and welcome to this audio summary of me reading anatomy to you. In this video, we'll cover the muscles of the pelvis. Those include the muscles of the pelvic wall and the pelvic floor, their origins, insertions, actions, nerve supply, and blood supply. Starting with the pelvic wall, we have two muscles, obturator internus and piriformis. The first muscle, obturator internus, has its origins on the ischiopubic ramus, as well as its own obturator membrane. It exits via the lesser sciatic foramen and inserts into the greater trochanter of the femur on the medial surface. The action depends on the position of the hip. So when the hip is extended, it provides a lateral rotation. When the hip is flexed, it provides abduction. Nerve supply is from the nerve to obturator internus, from the sacral plexus, nerve roots L5, S1 and S2. The blood supply is from the inferior gluteal artery, sometimes called the sciatic artery, and this is a branch of the internal iliac artery. The second muscle of the pelvic wall is piriformis, and its origin is the anterior surface of the sacrum, and it exits via the greater sciatic foramen, and in doing so it divides the foramen into two. Now, it also inserts on the greater trochanter of the femur, this time the superior aspect. And just as for obturator internus, it provides lateral rotation when the hip is extended and abduction when the hip is flexed. The nerve supply is the nerve to piriformis, from the sacral plexus, nerve roots S1 and S2. The blood supply is both the inferior and superior gluteal arteries, both of which are branches of the internal iliac. Let's move on to the muscles of the pelvic floor. It has two major muscles, levator ani, a very interesting muscle divided into three parts, and then coccygeus. Starting with levator ani, this is generally a broad sheet of muscle that extends from posterior to anterior of the pelvic floor, with important gaps for both anal and genital structures to pass through. And therefore the function is to support the viscera of the pelvis and also to provide urinary and fecal continence by a sort of sphincter action we'll discuss later. It's divided into pubococcygeus, puborectalis, and iliococcygeus most laterally. Starting with pubococcygeus, this originates from the body of the pubis and inserts into the coccyx and also a thickened line of connective tissue running in the midline. This is the anococcygeal ligament. The second muscle is puborectalis. This originates from the pubic arch and runs underneath pubococcygeus, where you can find it if you're looking in a specimen. It has no insertion, instead it forms a sling to return to its origin. Now the sling of this muscle travels around the lower GI tract, creating the perineal flexure. This is an angle around the anorectal junction which keeps it bent and closed. This is the sphincter action of levator ani. Finally, we have iliococcygeus, and this originates from the tendinous arch of the obturator internus fascia and inserts into the coccyx and the anococcygeal ligament in a similar way to pubococcygeus, and do note their similar names. All of the muscles of levator ani receive the same nerve supply, from the nerve to levator ani, from the sacral plexus, nerve root S4, as well as the inferior rectal nerve, a branch of the pudendal nerve, nerve roots S2, S3 and S4. The blood supply is from the inferior gluteal artery, which is the same for all levator ani muscles. Finally, we have the small and most posterior muscle of the pelvic floor, coccygeus, and this arises from the ischial spine and the nearby sacrospinous ligament. It inserts into the lateral coccyx and sacrum, which is why people sometimes call it the iliococcygeus. Its nerve supply is directly from the anterior rami of nerve roots S4 and S5. Its blood supply is from the inferior gluteal artery, as well as the inferior vesical and pudendal arteries. That's all. Thank you and see you next time.